Hello, my name is Madupe. Welcome to my YouTube channel. My last episode, I was talking about how I got placed on iron tablets. I was told to take iron ferrite, I think 200 milligram a day, and to take it with either ribena or orange juice first thing in the morning before eating, and to eat 30 minutes after I've taken it. I tell you, that was the worst medication of all of them because it made me really nauseous. Like the minute I take it, I will be so nauseous. I just took it anyway. I needed it, and it increased my iron levels to 85 from 78 down to I think the end of or the middle of second trimester. The details are not forthcoming right now. So the middle of second trimester, started having pains. See, this part of my pregnancy, I wasn't sure if I should share it or not, but I want to be as transparent as possible because there might be someone watching this video who is experiencing everything that I experienced during my pregnancy. You might not have sickle cell, but it's a common thing among women. I started having some weird pains in my abdomen and I was scared. I was like, oh my god. I started praying because if you got sickle cell, you have to hold God strong. I started praying because I was like, God, you've been so faithful. You helped me get pregnant, and my pregnancy has been okay. I didn't have any complications. All my tests are coming out okay. I started praying to God, like, I don't know what this pain is. Please just take it away. The first time I had it, it was terrible. I couldn't go to work. I couldn't sleep at night. I couldn't go to work for like 2 or 3 days. And I went to A&E. When I got there, gave them my whole history, and they said 2 things. First being that gosh, I can't remember what the other reason was, but I was told that it's likely due to fibroids. Going back to my first scan, I didn't realize I had fibroids until I had that scan. The ultrasound showed baby and fibroids. The pain I was experiencing was fibroid pain. I tell you, that pain was something else. The reason I was having the pain was because my baby was growing big, and because my baby was growing bigger, it was shrinking the fibroids. And there was something the guy said, red blood cells degeneration of the fibroids, as was causing the pain. Shrinking of the fibroids by the growth of the baby made it painful because it was like the fibroid was dying off. That's my understanding of what he explained. I had to deal with fibroid pain for like a couple of times. It was horrible, and I was told that anytime I had the pains, I should take paracetamol or codeine. Because I knew what the pain was, and if you have sickle cell crisis, you know that your threshold for pain is quite high. So I just managed it with paracetamol, and when it calmed down, I didn't take my paracetamol like every 4 hours because, like I said, just like with the antibiotics, I was so scared to take medications, even paracetamol, because I didn't want anything to affect my baby from medication. I had that pain, and after a while the pain stopped. Every scan I went to, they would measure the new size, and while my baby was growing, the fibroid was growing because my hormones were nourishing the fibroids. When it got to the part where I was having the pains, that was when the fibroid like stopped growing because baby was growing bigger and baby like shrunk the fibroid. Anyway, fast forward to, I'm always saying fast forward. So moving on to my birth story, I was still taking my low dose aspirin. I started taking my heparin injections. Just a minute, I'll show you what the heparin injection looks like. This is the injection that I took. This is what it looks like. This one is named ROV 4000 IU, which is 40 milligram, or God, I'm panting. I just ran down the stairs. Or 0.4 mil. It is called enoxaparin sodium. And in one of the appointments that I had, the midwife showed me how to inject myself. I was told to either inject myself on my tummy or on my thighs. And again, I wasn't comfortable injecting my tummy because my tummy was hard. I had a baby in there. So how do I keep injecting my tummy? So I went for my thighs. The easiest way for you to have it is to numb the area with ice for like 5 minutes. Then you can inject yourself, and you won't feel the sore nature of the injection. I started injecting myself with this at 29 weeks, but it got to a point where my husband had to do it for me because I couldn't anymore. This is a spare injection. I might as well show you guys how to do it. I had a sharp spin as well. The sharp spin, when it's full, you close it and you take it to the hospital because you cannot dispose the sharp spin with normal waste. Cap off. Yeah, you press this and it brings, if you can see there's a tiny drop there. Yeah, so you press this and it brings out the liquid into your body. Then when you finish, you press this harder. When you press it harder, it covers from here to here where you have the syringe. So it brings down, there's a spring here, I don't know how that works. The mechanism, it forces down the rest of this plastic to about this length so that you're able to cover the syringe, and then you put it in your sharp spin. I started taking this injection, continue with my low dose aspirin. I never mentioned what the low dose aspirin was for, to prevent preeclampsia. I think that has to do with the placenta of the baby and making sure it's all right. I continued my scans, tests. At some point, I think my first trimester, I lost some weight, and then I lost about 4 kg, and then I gained the 4 kg and an extra 5 kg. My pregnancy was monitored by this team, which I'm grateful for. Thankful for the technology and thankful for the care. The deciding factor for the method of birth wasn't clear to me. I was contemplating between vaginal delivery and a C-section. Mind you, the way that mothers in Nigeria give birth, most of them dealing with sickle cell, the doctors would even recommend having a cesarean because they don't want you to be stressed, laboring for long. But here, I am in a country where we've got the resources in place to take care of me, to take care of the baby, to make sure everything is okay. And if there's a need for a C-section, it will be done. So the crossroads on what to decide. Mind you, my team, the obstetrician in my team already said that was going to be induced at 39 weeks. That induction rang a bell in my brain. I'm not saying you should bank on the negatives, right? But I've seen so many stories where pregnant women go for induction, take the pitocin, at the end of the day, they get an emergency C-section. I don't want that to be my case. And I'm like, I was really scared about making a decision. I told God, please, just give me a sign. And my team, like I said, already informed me that at 39 weeks I would be induced. And I said to them, like, why should I get induced at 39 weeks? Why can't I wait for a natural labor to start? They said because my baby is big and they didn't want, the child to grow bigger. They didn't want the child to stay more than 39 weeks. Which is fair because at 37 weeks is already full term. When I got to 35 weeks, I went for my regular checkup. Voila. My little one, who has been engaged since second trimester, suddenly was breached. And I was like, Odupe, I think that's your sign here. Go for a C-section. So my next appointment with my obstetrics and hematologist, I told them that I would like to have a planned C-section, and they gave me a consent form to fill and everything, because now my reason for having a C-section is that, okay, baby has been found breached. If you're thinking that, oh, I've got sickle cell, I already have less blood, how do I go for an operation? Because prior to that birth of my baby, I've never had any surgery. Not only that, I've only had blood transfusion once in my life, and that was when I was a baby. My mom told me I cannot remember experiencing blood transfusion. So my mom told me I had a blood transfusion. That was when I was little. At that time, they were still trying to figure out what was the issue with me because I was sickly. They had not concluded that I had sickle cell. That was the only time that I had blood transfusion. Now, they needed to relate to my clinical consultant that has been monitoring me before pregnancy and let him know my levels to conclude if I will need blood transfusion before my surgery. That information was passed to him, and my consultant said, yeah, it would be okay to give me 2 pints of blood to increase my blood level before surgery. My cesarean section would be booked in for when I clocked 39 weeks, which was on the 29th of November 2024. My EDD was December 6th. I said to them, how about we move it a bit closer to the expected date of delivery? And they said, well, if I want it so, then that's fine, but they would advise the earlier the better so I don't fall into labor. Regardless, if I come into the hospital in labor before the planned cesarean and there are no emergencies worse than my case, then I'll be operated on. If not, then my planned cesarean will go as expected. Well, it got to the week before my planned cesarean section and I was told to take 2 pints of blood. I had the blood transfusion. I was so scared. I was worried about having someone else's blood in my body. I couldn't understand the feeling. And shout out to all the warriors out there. We are really strong. I know there are certain people battling with anemia, not just sickle cell, who have to go and receive blood. Imagine the psychological effect it will have on you, worrying about what if this blood is contaminated. I know the healthcare professionals do their job diligently, but you as a human being, that worry still comes. Like, what if this is going to happen? What if this goes wrong? What if my blood is not compatible to this blood that they say is compatible with mine? Before my blood transfusion, I did a compatibility test, and being that it was termed the first time, because like I said, the other time I had blood transfusion I was very little, so it was like the first time I having blood, so they had to do a cross match for me. It came out okay, but what if at the end of the day I react to it? Those were the thoughts in my head. I was so worried, I was scared. Those were the thoughts in my head before I went for the blood transfusion. Thankfully, again, had a blood transfusion. It went well. My blood levels increased from, was it 80 something up to 100. And then morning of the C-section, we were told to come by 7. By 6:30, myself and my husband were already there. And we were told that since it's a planned cesarean, first of all, if there's an emergency, they will have to attend to the emergency before us. We were 3 in number to have planned cesarean that day. 3, I think they have 3 in the morning, 3 in the evening. That morning it was 3 of us, and that we're going to be called into the operating room according to our health record. If you have like a more risky pregnancy, you go in first. I was the second person to go in. As I was going in, I was praying to God, like, God, this is in your hands, because I've never had an operation. I don't know what it's like. I don't know what's at the end of the operation. I was horrified. I was scared, but I was trusting God. God cannot be taken out of my story, because from, like I said, from beginning to end of the pregnancy, it was God. He was there for me, and it wasn't complicated. Even though I had, certain issues here and there, they're like normal issues in pregnancy. I was just trusting God that, please, I need to come out of this hospital with my baby. Anyway, went to the operating room. I was told to put a playlist of my selected songs, which I already made. I put the playlist. It was worship songs. I put the playlist, and I skipped the parts where I chose my method of what kind of anesthetics. Is it anesthetics? Painkiller. Let me just do the word. What kind of painkiller I'll be using. So I told them I didn't want an epidural, because from the stories I've heard about epidural, a lot of people end up with back pain. What they gave me was spinal, which is like, you know, how do I explain it? It's given on your back same way as epidural, but it's just one injection that numbs you from your stomach down to your legs. I think with an epidural, they leave something inside and they keep increasing the dose. I don't know how epidural works, so I might get it wrong. But I had spinal. Before they gave me that spinal, they had to give me a local anesthetic injection. I hope I'm getting that pronunciation right. So that when they put the spinal injection, I'm not going to feel it very well. My anesthesiologist was wonderful, superb woman. She held my hand from the beginning of my surgery to the end and gave me my baby. Like, she was amazing. She was there. She gave me the injection and she was telling me, how are you feeling? Don't worry, it will be over. My husband was by my side, of course, chatting me up. I just told him, just tell me anything. After they gave me the injection, I was told to lie down. I'm like, God, this is it though. It's in your hands. Perform this operation through these doctors. It's you I'm trusting. I couldn't feel anything, but the operation was going on and my husband did not want to look at the other end. He was beside my head. And so I had my husband on my right hand. I had the anesthesiologist on the left hand, and they were with me the whole time. And at some point, nobody tells you during CS, at some point I felt juggling. You know, it was like something was moving inside my stomach, like they were dragging something. And so when they were dragging, I didn't know that they were pulling the baby out. I was like, what is that? What is going on? And I was like, it's fine, don't worry, it's fine. So the anesthesiologist was like, don't worry, they're just getting the baby out. I'm like, okay. They got the baby out and I was waiting to hear the cry of the baby. 1, 2, 3, and then I heard, yeah, the baby started crying. I was like, oh my God, that's my baby. Oh God, I'm getting so emotional. Anyway, it took the baby and they were doing the other team. They were doing the necessary with the baby, and then they were suturing me up. Finished the surgery and they transferred me from that bed to another bed. Before they transferred me, they brought the baby to me, and I was like, yeah, you cannot take that experience away from any woman. And I pray that every woman who is going through pregnancy would be able to hold their baby at the end. Nothing will happen to you or your baby, because that feeling of holding your baby is overwhelming. It's the best in the world. It's the best. I had my baby and they transferred us to the ward. Subsequent videos, I'm going to be talking about certain things that people don't tell you when you give birth. You have to experience for yourself, and you're like, why is nobody talking about this? Because this is horrendous. Thank you for listening to my story. I hope you enjoyed it, and I hope you learned 1 or 2 lessons from this whole journey of my pregnancy. There's anything that I didn't remember to say. It's been a couple of months since I gave birth, and you know the mom brain, yeah. And I did this video just freestyling. I didn't write anything down. For my subsequent videos, I'll be doing like short videos on, you know, certain things that you should prepare yourself for and look forward to or avoid. Yeah, so my name remains Mudupe, and stay tuned for more stories, and I hope you subscribe and share this video. Thank you. Bye.